Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. We are in one of the enrollment periods for Medicare, which is Medicare Advantage. And I found an article here, 13 Things Medicare Gives You for Free. Now, I partnered up with Chapter. They provide free resources and direction and suggestions, advice, all that good stuff for all things Medicare. I'm going to drop their link in the description and in the comments for you if either you are turning of age for Medicare or you're interested in Medicare Advantage, or if you have any Medicare related questions. This is for everyone, veteran, spouse, parents, what have you. So please share that information. Let's jump into it. Hit the thumbs up, subscribe, share with a friend. I really appreciate it. All right, so 13 things Medicare gives you for free. Medicare beneficiaries often pay monthly premiums, copays, annual deductibles, and prescription drug costs. But what you may not know is that some services don't cost anything at all. So let's jump into it here and see what they have to say. Medicare is a federal government health insurance program primarily for people 65 years of age and older. And why am I talking about it on here? Well, I'll tell you why. Because less than half of all veterans are enrolled in VA Healthcare. Less than half of all veterans are enrolled in VA Healthcare. And a very, very tiny percentage of spouses are eligible for CHAMP VA. So they would then need to enroll with Medicare at some point. The VA also suggests enrolling in Medicare even if you have VA healthcare. So that's why I'm sharing it. Let's jump back into it. However, Medicare can also cover younger individuals with specific health conditions and disabilities. Medicare includes different parts, which provide different types of coverage. Hospital insurance, which is Part A, medical insurance, which is Part B, Medicare Advantage plans, Part C, and prescription drug coverage, Part D. While some services come at a cost, Medicare also offers many services with no out-of-pocket cost at all. That said, some of these freebies may not be available with Medicare Advantage, and there may be limitations on how often you can take advantage of these free services. Still, it's worth knowing about these 13 Medicare things that are for free. So, number one, a welcome checkup. Your free welcome visit must take place within the first 12 months of signing up for Medicare Part B. Think of this visit as a time when your provider will establish a baseline for future care. Your medical history and medications will be reviewed. Your provider will also take your blood pressure, height, weight, do the simple vision test, and ask several questions about your mental and behavioral health. You might also get a flu or pneumococcal or other preventative care shot if you elect to do so. You won't pay a deductible for this welcome appointment, but you may be responsible for a co-insurance. If your provider performs other types of tests, you also may have to pay a deductible. Just kind of depends. Always ask and get more information. Moving on, number two, yearly wellness visits. According to Medicare, your yearly wellness visit is to update your personalized plan to help prevent disease or disability. It is not a comprehensive annual physical exam, which Medicare doesn't cover. Instead, your provider will complete a risk assessment and use the results to update the care plan created during your welcome visit. Keep in mind that you can't schedule an annual wellness visit within the first 12 months of signing up for Medicare Part B. All right, next one is seasonal vaccines for those that are interested in that sort of stuff. It says here that Medicare covers most vaccines at no cost to enrollees who have Medicare Part D prescription plans or Medicare Advantage drug coverage. Thanks to the Inflation Reduction Act passed in 2022, these vaccines may include shots for shingles, respiratory, I'm not sure how to say that, syncytial virus, I don't know, RSV, COVID-19, hepatitis B, the flu, and more. People who are at a greater risk of complications or hospitalizations from these illnesses can greatly benefit from these free vaccines. Number 4, alcohol counseling. Medicare will cover the costs of one screening for alcohol misuse each year. If you use alcohol but haven't received an alcohol dependency diagnosis, your primary care doctor or other healthcare provider may determine you are misusing alcohol. If so, you can receive up to 4 face-to-face counseling sessions in your doctor's office or clinic each year. About 18 million adults in the U.S. have an alcohol use disorder, an AUD, making this a valuable service for those who need help. All right, number 5, treatment for opioid use. 7 out of 10 overdose deaths are caused by opioids. Medicare covers the cost of recovery treatments for opioid use disorder, and you won't pay a copay if you receive your treatments through an opioid treatment program that is enrolled in Medicare. Although your treatment plan may include overdose training, assessments, drug tests, therapy, and more, your Medicare Part B deductible does apply to any medications or other supplies you receive as part of your treatment plan. Next one, the I can't, whatever. It's like a mix between colon and rectal. Colorectal screenings. All right. So, colorectal cancer is expected to cause about 52,900 deaths in the U.S. in 2025, according to the American Cancer Society. A screening for colon cancer can help ensure that doesn't apply or doesn't happen to you. Medicare covers 4 screening tests for colorectal cancer, including a fecal occult blood test every 12 months starting at age 45. Okay, so I'm 50, so this is stuff that I actually have to start paying attention to. All right, so the flexible word I can't say, sigmoidoscopy every 48 months, also starting at age 45, which I haven't done. Stool DNA test every 3 years for people between the ages of 45 and 85, another thing I haven't done, who are not at high risk of colon cancer and have no symptoms of colorectal disease. A screening colonoscopy every 10 years if you are not at high risk for colon cancer, or every 2 years if you have a family history of colon cancer or have past colon problems. All right, so fun. Number 7, depression screenings. Medicare Part B recipients receive 1 depression screening in their primary care provider's office each year, free of charge. During the screening, you may be asked about sleeping habits, if you've contemplated suicide, if you have feelings of hopelessness, etc. If your provider recommends follow-up treatment, then your coinsurance under Part B would apply. Since about 21 million adults in the U.S., that's 8.4%, experienced a major depressive episode in 2023 alone, it's worth it to be screened, especially since it's covered. Number 8, yearly mammograms. Once a year, Medicare will pay for a screening mammogram if you're a woman over the age of 40. Yet 59% of respondents of a survey given by MedStar Health say they typically forego the recommended routine exam. If the screening mammogram shows suspicious results, your healthcare provider may order a diagnostic mammogram. If this happens, you might be responsible for some of the costs of the diagnostic mammogram. The same applies if your doctor orders a breast ultrasound. Diabetes screening. Just over 38 million people have diabetes in the U.S. That's a problem, by the way. So with that many, it's really important to make sure that you get that screening. So just over 38 million people have diabetes in the U.S. According to the CDC, yet 22.8% of adults with diabetes are undiagnosed, even though Medicare Part B covers up to 2 diabetes screenings each year. Your provider will determine if you are at risk for developing diabetes and if you have risk factors such as high blood pressure or history of high blood sugar. Medicare Part B will also cover these screenings if 2 or more of the following conditions apply. So they got a few different things here. You are over the age of 65, you are overweight, you have a family history of diabetes, you've had just the pregnancy diabetes, gestation. For all the women who've been pregnant out there, you know what I'm talking about. While you're pregnant, right? That one. Anyway, 10. Lung cancer screenings. Mayo Clinic states that lung cancer is the leading cause of cancer deaths nationwide, or worldwide, and you don't have to be a smoker to get lung cancer. Medicare will cover 1 screening each year using low-dose computed tomography if you're age 50 to 77. See, another thing since I'm 50. So, yay. And have no signs or symptoms of lung cancer. You smoke now or you've smoked in the past 15 years, have a history of smoking, and can get an order from your healthcare provider for the screening. Number 11, and we're going to 13. Number 11, yearly prostate cancer screenings. Approximately 12.8% or 1 in 8 men will be diagnosed with prostate cancer at some point during their lifetime. But did you know that more than 99% of prostate cancers occur in men over the age of 50? Another thing that I got to think about now because I'm 50. All right. Medicare Part B covers the cost of yearly prostate-specific antigen lab screening and a digital rectal exam starting the day after your 50th birthday. All right. Next one. 12. Nutrition services. If you have kidney disease or diabetes, or you've received a kidney transplant in the past 36 months, Medicare will cover some nutrition services, including an initial nutrition and lifestyle assessment to help you manage your illness. Follow-up visits to your doctor and individual or group sessions may also be covered. All right, next one. Number 13, bone density tests. Bone density tests can help measure whether or not you are at risk for broken bones. They are free to eligible Medicare recipients every 2 years or more often if ordered by your healthcare provider. To qualify, you must meet 1 or more of the following criteria. You are a woman diagnosed with estrogen deficient estrogen deficient and at risk of osteoporosis. Your x-rays show possible osteoporosis, osteopenia, or vertebral fractures. You take steroid type drugs. You have primary hyperparathyroidism. I don't know. It's hyperthyroidism with a para in the middle. So hyperparathyroidism, I don't know that one. Or you are on osteoporosis drug therapy. All right, so with that, let's cover really quick 9 things Medicare doesn't cover here on this as well. And this is just a quick list of 9 things. So Medicare covers most healthcare needs for older Americans, but as a rule, some things just aren't part of the program. It says here, number 1, dental work. 2, routine eye exams and glasses. 3 is hearing aids. 4, many chiropractor services. That's 4. 5 is elective cosmetic surgery. 6 is massage therapy. 7 is podiatrist routine foot care. 8 is medical costs outside of the U.S. And 9 is long-term care. Here we go with the bottom line, a small little paragraph. If you've signed up for Medicare, it's time to start taking advantage of these 13 free services the program offers. Schedule your welcome visit right away and tuck the cash you save under the mattress for a rainy day. Or better yet, pay down high interest debt. Start an emergency fund or splurge on yourself. After all, you only turn 65 once. And that's how it concludes. Thank you so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.